Hi, this is Courtney Clarke with Turkish-American Television. Very excited to have an RN in the studio today. Gül Ok is here with us from Massachusetts. She is an RN in the front lines, one of our healthcare heroes in the middle of the COVID crisis. She works with COVID patients and she just got the COVID vaccine. Welcome, Gül.
Thank you. Hi, Courtney. Thanks for having me.
Well, we're really excited to talk to you today about your experience getting the vaccine. You just got it last Friday, right?
Yes, that's right.
Great. And we've been hearing a lot of things about the vaccine, a lot of controversies, but you were really comfortable getting it and ready to get it. So, so when you first heard the vaccine was being rolled out, did you think it would be rolled out as quickly as it has been?
Not at all. It was very quick.
So what do you do in your role as an RN and what qualified you to get the vaccine now?
I work as a nurse at local hospital on a medical surgical floor, taking care of acutely ill people, patients, directly involved with COVID patients, especially on my floor. We take care of COVID patients. So we knew once the vaccine was approved, we'd be getting the vaccine first.
As an RN, I imagine it was an emotional time working with COVID, like since March, it didn't exist prior to that. How has your experience been working with COVID patients?
It was scary at first because we didn't know how sick people were getting. We didn't know much about it. There was so much information. But again, it's my job to take care of sick people, and then we continue to take care of COVID patients.
And I imagine you've learned so much about COVID along the way. There was, like you said, so much we didn't know at first.
There's still so much more we're learning about. It's very new.
The interesting thing about the vaccine, so we have two companies that have been able to distribute it so far, Pfizer and Moderna. Moderna is brand new out in the market. So Pfizer is the one that you received. And then there's been a lot of controversy. Some people want to get it, some people don't, even in the healthcare space. So why was it important to you as an RN to get the COVID vaccine?
First of all, I want to get protected so I can protect others. I didn't want to catch COVID and give it to my patients or my family or my friends.
And you trust the science. So obviously we don't know all the side effects yet. But you had the vaccine. What was the day that you had it? And what were your side effects immediately following?
I had the vaccine last Friday on the 18th in the morning, and it didn't hurt a bit. Usually flu vaccine hurts, but this one didn't hurt. And I pretty much had no side effects other than a little bit of soreness, which is expected from vaccines.
And did they kind of prep you on what the side effects could be? I hear that the second vaccine may be even slightly more side effects than the first one because there's 2 doses required, right?
Correct. Well, first of all, it's the new vaccine, it's the medication, so it's normal for you to possibly or potentially have a side effect because it's the first time your body is receiving it. I knew that, we knew that, but to me, I don't want to get side effects from COVID in the long term. To me, I rather get the long-term side effect from a vaccine, which I believe there will be none.
So in the long term, why do you feel the vaccine is important for so many people to get it?
Because of herd immunity, I believe it's 75% of world population needs to get this, so we're not keep giving it to each other anymore.
Yes, we can get past this COVID phase.
Yes, I know, definitely.
Well, I mean, we really appreciate the work you've been doing. How has your role changed since COVID broke out?
I really can't say it really hasn't much at all because it's my job to take care of the sick. I cannot refuse a patient because, they have COVID and I work with COVID patients. So I go to work, I'm careful. We have the proper PPE and all I can do is do my best to give the best care I can.
What has been the sentiment among your colleagues for getting the vaccine? Does everyone seem to be kind of on board or is it mixed?
It's been mixed. We were all just, doing our own research, just waiting for it to come out. I was also questioning it too, but The more I read about the studies, they did, I believe, more than 20,000 people. I believe that it's going to protect me in the long run. And there are some people who have either certain allergies or autoimmune disorders. They don't want to get it now. That doesn't mean they won't get it, but they want to wait. They want to see more people getting it, and then they're going to feel more comfortable getting it. So I believe a lot of people are getting it at my hospital.
Tell me, and let's switch gears a little bit. Tell me a little bit about why you became an RN. It's such a selfless role. It's hard work. And I mean, it sounds like you're really invested in helping other people. Why did you become an RN?
Funny you asked that. Actually, this is about maybe 17 years ago or so. I had this cyst in my liver that I had to have it surgically removed. At the time I was studying business. So I had to have that big surgery. I was fine afterwards, but being in the hospital, I realized that having some really caring nurses and some, made a big difference in my patient bed. Not at that time I decided, but after several months, I decided I want to do something rewarding. I want to be that nurse when my patient sees me. Oh, Rosie, I'm so glad you're here today. I wanted to be that nurse. And I still share this story with my patients. And then they say, oh, I can totally see that. And then they feel it.
That's wonderful. Well, I mean, it's definitely, you guys have been called superheroes. You've been called, heroes on the front lines. And I'm sure to you, it's just doing your job, but to the rest of the world, to see you doing really important work and work that, some people are afraid to do. And we really, I think the world really, eyes are on nurses right now, and so appreciative of nurses and physicians and everyone in the healthcare space.
I take a pride in what I do. If I didn't, I couldn't do this, even before COVID.
So what does a normal day look like for you when you leave work and you come home and you have to decontaminate? Like, what does that process look like?
So when I leave my house, I have two different shoes. One I wear in my car, and when I get to the hospital, before I get in the hospital, I change into my hospital shoes. That way, when I'm done with my shift, I'm not bringing my hospital shoes back in the car. And then before I start my shift, I will wear a new uniform. And at the end of my shift, I will leave that uniform at the hospital, and I put my clean uniform back on before I go home.
So is it a whole new process for you, or is it, you guys had a process to begin with. You're used to wearing masks, but this is kind of another level, right?
To be honest, I did the shoe trick before, because even before COVID, we have other contagious diseases that I didn't want to bring home. So shoe is not new for me.
Are you wearing the N95s at work?
Absolutely.
Yeah. So are you getting the lines on your face? And it really is like battle scars.
Yeah, you can't really see it now, but they call it smack knee. I try to cover them, but we have smack knee, but it's not a big deal.
Yeah. And I imagine, with you're used to wearing masks anyway.
Yes, it's not a big deal.
Yeah. And one of the challenges with COVID, by the time I think this is something that people have to understand, is that the reason the surges are so important and why we have the lockdowns is so that we have capacity and we have beds available for patients that need it, not just COVID patients, but others. And by the time a patient reaches the hospital, a lot of people have had COVID, but if you're so sick, you need to be in the hospital, you're pretty sick. So I imagine you've seen a lot of really sick patients as a result of this virus.
Yes, absolutely.
Which just makes the vaccine that much more important in your mind, I imagine.
Oh, absolutely.
Well, it's amazing to hear that you had no side effects, knock on wood. I know you have your second one coming up. Was it 21 days later?
21 days.
Okay, so we might have to regroup with you after that one, but I'm really glad you had no side effects.
No side effects. I feel great.
That's great.
And I'm hopeful. I hope, if people are still thinking about it. It's okay to think about it, but just think about the big picture. Nobody wants to live in this world. I mean, everybody, I mean, this is a new world. And I mean, after the vaccine, we're going to have the herd immunity, hopefully, and then we won't be scared to go out anymore.
And Massachusetts saw quite a big spike. Are you in the second surge right now, or where does Massachusetts kind of stand?
I believe we are getting a lot of COVID patients these days.
Mm-hmm. We are here in Washington, D.C. as well. I think we're starting to see the effects of Thanksgiving and, like,
yeah, the cold weather, you can't really go outside. So it's all.
What advice would you give to your friends and family for keeping safe during COVID, even after someone has the vaccine? What do you recommend people do to stay safe?
Even if you have the vaccine, I believe we should still wear our masks, because even though the vaccine will protect us, they're saying 95%, we can still get the COVID, we can still catch it, but hopefully it won't be as harmful, and we'll have the disease lighter. So keep wearing a mask on. Try to keep your social distance until we get rid of this to a more comfortable level.
Really important for people, especially as we enter the winter season.
Absolutely.
And if, as an RN, you already worked, I'm sure, really long hours, but now there's that sense of COVID fatigue and burnout. Like, what do you do for self-care? What do you do to decompress and help yourself recharge so you don't burn out?
It's a good question. Life is so busy. I'm a mom also to a 4-year-old boy. So when I'm home, I actually don't think about work. I spend time with my son. We go to playgrounds, it's still cold, but we can still go. And I just rest, I guess, watch TV. We don't really go anywhere indoors. Still keep it busy.
How is it having a 4-year-old during COVID? Does he understand what's going on?
He does and doesn't. He's 4 years old. He doesn't have a problem wearing the mask. I said buggies, COVID buggies. So I try to explain to him, if we don't wear a mask, we'll get sick, and we don't want to get sick. So he knows that much. And if I try to explain more, but he doesn't really understand more than that.
It's an interesting time to have children. I mean, they're kind of learning that wearing masks in public is normal, and cross the sidewalk when you see someone coming, that sort of thing. So I'm sure that you as a clinical person can explain things in a little, different way to him than maybe the average parent, but it is a lot. You're having to wear multiple hats, and I think that must be pretty challenging.
It is.
So again, thank you so much for joining us today. Is there any other parting words or any other thing that you want to share before we end?
I'm trying to stay positive. I believe in this vaccine. I hope people can have faith, and just hoping for the best.
Well, thank you so much for coming on and talking to us about this. And we really appreciate your time today.
Thank you for having me. Thanks.